Okay, so our topic that we're going to be discussing is seizure disorders in children and kind of what people can do if they want to help someone who is having a seizure or just had a seizure and the steps they can take to help them. So to start off first, what are seizures? Seizures are when the brain consists of nerve cells that communicate with each other through electrical activity, and there's one or more parts of the brain that has a sudden burst of abnormal electrical signals to disturb the normal ones that are going on. Anything that interrupts the connections between the nerve cells can cause that seizure and can also cause changes in the behavior, movements, feelings, and also the level of consciousness of that person.
Okay, so the causes of seizures, there are multiple causes. The first one is epilepsy, and it's just a brain condition that causes a child to have seizures, and it's diagnosed after the child has had 2 or more seizures with no known cause. So you can have a seizure without having epilepsy, but you can't have epilepsy without having a seizure. Seizures can also happen because of other medical problems, such as a high fever, low blood sugar, and people that are going through withdrawal from alcohol and drugs can also have a seizure. Epilepsy can be caused by different conditions that affect a person's brain, such as loss of oxygen to the brain. So this can happen at birth and cause a newborn to have a seizure. Some genetic disorders such as Down syndrome, other neurological conditions such as Rett syndrome, a stroke, brain tumor, a traumatic brain injury, and also a central nervous system infection.
So some signs and symptoms. So all of these symptoms obviously vary from person to person, but we just listed a few of the most common. So staring, jerking movements of the arms and legs, stiffening of the body, loss of consciousness, some breathing problems or stop breathing. Sometimes they lose control of their bladder and their bowel. Falling suddenly for no apparent reason, especially if they lose consciousness during it. Not responding to noise or words for brief periods. Appearing confused or in a haze. Nodding their head rhythmically when associated with loss of awareness or consciousness, and periods of rapid eye blinking and staring. So some seizures just look like someone is staring or having a staring spell, while other seizures can actually cause a person to fall, shake, and lose awareness of their surroundings.
I'm going to discuss some different types of seizures that can occur. So there's 3 major classification systems of seizures. They are the focal onset, a generalized onset, and an unknown onset. So the focal onset, that just means that seizures begin in one area of the brain or a group of cells on one side of the brain. And focal can also be an onset of aware seizures and onset impaired awareness. So the onset aware seizures, the person is just going to be awake and aware that the seizure is occurring. Onset impaired awareness, the person may appear to be confused or awareness is just affected in general. The next classification is generalized onset, and then this is going to affect both sides of the brain or a group of cells on both sides of the brain at the same time. And there's 3 different types of generalized, and they were tonic, clonic, absence, and atonic. So the tonic-clonic is also known as the grand mal, or whenever people hear that someone's having a seizure, you may think of convulsions, and that's typically what we think of. So with tonic-clonic, the tonic is going to happen first, and that is just stiffening of the muscles, and then the clonic will occur, and that is the jerky-like movements. After the seizure has occurred, the individual may appear to be confused or sleepy, and it only lasts around 1 to 3 minutes. But if it lasts more than 5 minutes, then it is considered a medical emergency. The absence is when there is a cause of lapses in awareness, and they may appear to be just staring off, or also they may be known as, you may think the patient is just daydreaming. And with the absence, it only will last a few seconds, and this type is more common in kids. The atonic is a sudden loss of muscle tone in the head and the body, and these individuals will just appear to go limp. Atonic is also known as drop attacks, and in some kids, only their head will drop. The last onset is unknown onset, and the seizure begins just in an unknown area and typically not witnessed by anyone. And later on, with more like looking more at the seizure occurring, it may just appear to be a focal onset or a generalized onset.
So now I'm going to let you guys just watch a video that kind of shows the different types of the focal onset, partial, the generalized tonic, clonic, and the absent seizures. That way you just have a better understanding of what these seizures may look like.
What will I do? I have an... Okay, let's have it.
Tommy is having an absent seizure. This type of seizures is characterized by a brief staring spell that may reoccur up to hundreds of times a day.
I have an idea. Good. There is the camera. I will take a picture. Here it. What's it coming? Let's sound it up. C-O-M-E-S. What's up with the C make? Comes.
Molly, do you have any jacks? Dad, do you have any fours? Goldfish?
What's he doing?
It looks like he's having a seizure.
What's happening?
He's having a seizure. You're
Oh,
fine.
I heard that you need to put something in his mouth.
No, we don't need to put
Yes,
anything in
he'll
his mouth.
swallow his tongue.
It's impossible to swallow his tongue. He'll be fine. Just let it go.
We should hold it up.
No, no, let it.
No, but it'll stop it.
No, it won't stop his seizure, and it could harm him.
Is it contagious?
No, it's not contagious at all. We just need to let it run its course and make sure that he's safe.
How long will it last?
It depends. It could last a few seconds or it could last a few minutes. One thing we can't see is if he has a medical alert or some sort of ID bracelet. Yes,
What's that?
it's an ID bracelet that tells us what he has and what to do. There's an 800 number on here and an ID number that has, and then you can tell them on the 800 number. Here's the number. It's 1-800-625-8780.
And again, with the tonic, clonic, at the beginning, you could see where his body just went stiff, and then he fell and started doing the clonic part, which was the jerky movements. And then next, I'll just fast forward to show the focal partial onset.
Yeah. Oh, yeah.
Molly is having a seizure that begins
again, that was just a video to show you more, just to see a better and have a better understanding of the focal partial onset and the generalized tonic-clonic and absent seizures.
Okay, and there are some triggers and some things that can cause someone with a seizure disorder like epilepsy to have a seizure. And a trigger is just defined as something that occurs fairly consistently before the seizure occurs, more often than by chance. And some examples of these triggers are specific times of day or night, depending on some people. Also sleep deprivation, because seizures are very sensitive to sleep patterns, and the lack of sleep can not only have them have a seizure, but also those seizures may have increased intensity or length of the seizure. Some more triggers are fevers or other illnesses, flashing bright lights or patterns, and I think that's the one most people think of often, and it's also known as photosensitive epilepsy. And an example of this is TV or video games with a rapid picture image that can cause the seizure. Some more triggers are alcohol or drug usage, stress, menstrual cycles or hormonal changes in women, and also use of medications. And an example of this is one of the ingredients in Benadryl can cause a seizure.
Okay, so what do you do when someone is having a seizure? The first thing you want to do is just remain calm. If you're not calm, more likely you're going to make a mistake. Then look around. Is the person in a dangerous place? If they are, you don't want to move the patient or the child. You want to move the surroundings. So if there's a pointy object by them, remove that. If there's furniture that could hurt them, you want to remove that. Note the time that the seizure starts. So you want to know the duration of the attack, because after 5 minutes, as Alicia said, it's considered a medical emergency. Then stay with them. If they don't collapse but they seem blank or confused, you want to gently guide them away from any danger, like the furniture or a pointy object. And then you want to speak calmly and quietly to them, just to make them feel like they're okay and nothing bad is going to happen. Cushion their head with something soft if they collapse on the ground. So if you're wearing a jacket, you can remove that. If there's a blanket around, put that under their head just to protect their head if they're having those convulsions. Don't hold them down. So if their arms are shaking during their seizure, you don't want to strap their arms down. And then don't put anything in their mouth. This is a common misconception with a lot of people. They think that if you put something in their mouth, it's going to protect their tongue and they won't bite it and their mouth will swell like it normally does. But this is not the case. You do not want to put anything in their mouth. Then check the time again. If the seizure doesn't stop after 5 minutes, as we said, then we want to call for an ambulance. Then after the seizure has stopped, you want to put them in the recovery position, which Alicia and Maddie will demonstrate later, and then check if their breathing is returning to normal. Then gently check their mouth to see that nothing is blocking their airway, such as potential food or false teeth in older adults. If their breathing sounds difficult after the seizure has stopped, you want to call for an ambulance. Then stay with them until they are fully recovered, and then ask the person questions to help orient them to person, location, and time. And this was all from this Epilepsy Society's website, but we found another website that had some other recommendations that you do. One is remove anything that's tightly, like any tight clothing around their neck, because then that can prevent their breathing from returning back to normal. And then the other one was maybe having a blanket covered over their body while they're having a seizure, because the article said that maybe they will release themselves and use the restroom while having a seizure, and that would just help them maintain their dignity if you put a blanket over them.
Okay, so now we're going to talk about when you should call 911. So if someone is already diagnosed with epilepsy and they are having a seizure, there's really no need to call 911. But these are some times that you should call 911. So if it is the person's first seizure, if they're injured badly, if they have trouble breathing after the seizure is over, if they have multiple seizures back to back without any rest period between, if the seizure lasts 2 minutes longer than their typical seizure would, if the seizure lasts more than 5 minutes, or if the person having a seizure is pregnant or they have any other medical diagnosis.
So now we're going to discuss the recovery position, and Taylor's going to be putting Maddie who just had a seizure into the recovery position. For step 1, you'll move the arm closest to you out to the side and form a right angle with that arm. Step 2, place the palm of the far hand on their opposite cheek. Move the far leg so it's a right angle to their body, and gently roll the person towards you on their side. Step 3, adjust hand and leg position appropriately and ensure their head is tilted back and they are breathing. Step 4, stay with them until they have recovered. And then within this step 2, you want to just kind of talk to them, and once they're aware, kind of start asking them some different questions.
So Maddie, I'm gonna let you rest for just a little bit, okay? You can just stay right there. And after a little bit to where she's able to talk to me and she's more aware of where she is, I'll start asking her questions. So can you tell me your name?
Maddie,
Great. And do you know where you are?
I'm at school.
Yes, very good. And can you tell me when you were born?
March 27th, 1995.
Very good. And do you know who I am?
Yeah, you're Miss Katoy.
Yes, awesome. Okay, do you feel okay now? Would you like to slowly get up and maybe we can sit in a chair?
Yeah, I think so.
Okay, I'll help you up. Ready? Oh, there we go. All right, let's sit down for a little bit.
Okay, so if someone is in a wheelchair and having a seizure, there's different steps that you should follow. So you want to put the brakes on the chair to stop the chair from moving. The convulsions could cause the chair to keep rolling, so putting the brakes can stop that. And then let them remain seated in the chair during the seizure unless the healthcare plan says otherwise. If they have a seatbelt or harness on, you want to leave it fastened. And then if they don't have one, you want to hold them down gently, not very hard like the other recommendation said, but very gently, just so that they don't fall out of the chair. And then as the other recommendations said, cushion their head and support it gently, because as I have previously stated, if they fall or hit their head on something, that can cause a TBI, which also can cause a seizure to happen again.
So after a seizure, you don't want to leave anyone alone until they can answer the 4 W's, which is who, what, when, and where, until they can talk or communicate in any way, if they are breathing normally, or until they are able to wake up if they did fall asleep after this seizure.
So lastly, we really just wanted to discuss some facts that we found were interesting during our research. And these are all according to the Centers for Disease Control and Prevention. So around 1 in 10 people in the U.S. has had a seizure. In 2015, approximately 1% of the total U.S. population had active epilepsy. And again, with epilepsy, it's the 4th most common neurological disorder in the United States, after the first 3, migraine, stroke, and Alzheimer's disease. 60% of epilepsy cases actually have no known cause.
Okay, so for some treatments, we just wanted to list these just so you were aware of them. So epilepsy patients have daily medications that they need to take. They could have brain surgery, vagus nerve stimulation, responsive neurostimulation, and the ketogenic diet. But for educators and SLPs in a school, your main concern would just be making sure that they take that daily medication that they need in order to prevent seizures from happening at school.
And there are our sources.
So we chose to do seizures because we realized that down in the clinic, a lot of our clients that we could potentially had a medical condition that had a risk of having seizures. And when we were reading it in our med book, we were like, we would have no idea what to do if one of our clients had a seizure. So we thought it was important information for SLPs and even teachers, educators, any person in a school district to know how to deal with a